Hello, everyone, and welcome to our webinar. Every year, from September 15 to October 15, we celebrate National Hispanic Heritage Month. This year, we celebrate school mental health personnel for their effort, dedication, and commitment to reducing mental health disparities in Latino children and youth. Today is the second part of a three-part webinar series, Back to School, Promoting Resiliency and Mental Health Wellness in Latino Children, Strategies for Parents. Our speaker is Diane Arms. She is the director for the Center for Co-Occurring Disorders at the Council on Recovery. She has dedicated her career to serving the Latino population in the health field, including mental health and substance use. She received both her Bachelor's of Arts and Master of Arts degree in clinical psychology from the University of Texas at El Paso. Please read more information about our speaker on our website. The MATTC uses affirming, respectful, and recovery-oriented languages in all our activities. This presentation was prepared for the National Hispanic and Latino MATTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, SAMHSA. All material appearing in this presentation, except that taken directly from copyright sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the author. This presentation will be recorded and posted in our website. Please welcome Diane Arms.
Good morning or afternoon, wherever you are, everybody. Buenos dias. I am excited to be back again with the NHL MHTTC presenting on resiliency and mental health wellness in Latino children, a very near and dear subject to my heart. Today, we're specifically talking to teachers and school administrators and school personnel for strategies on how to promote this resiliency. I have no conflicts of interest to disclose. Today's objectives will be to understand the impact of the pandemic on school personnel and increase strategies to boost resiliency and improve mental health wellness, to also understand the impact of the pandemic on students and do the same in increasing strategies to boost resilience, and to create a plan to deal with future unprecedented situations like a global pandemic. So we're going to start off with a word cloud. I know most of you on here are teachers, and I'd like to ask you if you could please put in the word cloud, one word that describes your state of being over the last 18 months. So what you're going to do is you're going to text to I think it's 3. Let's see, 22233. 22333, and you'll text Diane Arms at 865. I'm going to go ahead and switch the screen and we'll go ahead and see what that word cloud shows. Let's see, no responses yet. I will say that this is a very engaging presentation. We will require your participation. Exhausted, ugh, yes. Overwhelmed, drained, burnt, drained, uneasy, confused. So it looks like exhausted and drained are pretty much leading the show here. The bigger the word, the more times that it has been been chosen. Oh, somebody said motivated. Okay, that's good. Well, it's no wonder why you feel that way. This is a quote from Heidi Crumine, a high school English teacher in New Hampshire. And she said that this has been the most challenging year she's ever encountered. And she says that as someone who started her first day of teaching on 9/11 in the Bronx in New York City. You are not alone in feeling this. Let's take a global view. So over the last 18 months, CDC has reported that 40% of adults in the US have been struggling with mental health or substance use issues. This is compared to the 10% that was reported pre-COVID. Almost out of 190 million emergency department visits, they found that visits rate for mental health conditions, suicide attempts, drug overdoses, and child abuse and neglect were higher in mid-March through October 2020 than the same period in 2019. And according to Mental Health America, 74% of providers were seeing more patients with anxiety disorders, 60% were seeing more depressive disorders, 30% were seeing more patients overall, and screenings for anxiety and depression were up 634% and 873% compared to pre-COVID. If you can imagine that, that is a huge number. So let's talk about if the general population is experiencing these increases. Imagine what teachers and administrators who had to juggle their own family at home and 30 students with spotty Wi-Fi, frustrated parents, and still have to provide an education. I can only imagine what you all are feeling. According to an extensive survey of kindergarten through 12th grade teachers, there's no different than the words that you provided in the word cloud. 81% were feeling somewhat or extremely uncertain. 77% were feeling stressed. 75% were feeling anxious. 74% overwhelmed, 60% sad, and 54% lonely. I think all of those words were in the word cloud at one point. And then additionally, a quarter of the surveyed population said that they were going to change positions. They would leave the profession after the 2020-2021 school year. That's a 25% decrease in a workforce reduction. 45% of principals said that they started thinking about leaving their profession as well. So, all the questions that you all were being asked, or you all were asking, am I safe? Are my students safe? How can I emotionally connect to students online? What should I say to concerned parents? What about my students that are struggling with trauma already? How can I connect to students with social distancing? And will this change again tomorrow? With all of these questions, boom, of course y'all were gonna feel burnt out. So let's talk a little bit about signs of burnt out. As a mental health professional, these are clear signs and indications that people are feeling burnt out. High rates of absenteeism. So you see students missing, you see staff as a school personnel, as a principal, you see staff that are missing. You may want to ask how they're feeling if they're feeling burnt out. Fatigue and sleep issues, constantly, always tired. I know as we get to be adults, it feels like the tiredness is never ending, but it's a little different when you're feeling burnt out. It's like constant and you're having difficulty even completing small tasks that you weren't having difficulty beforehand. Also behavioral changes such as withdrawn being withdrawn, or even not attending or not having social interactions, whether that be virtual or in person, now that things are opening up just a little bit more. Additionally, another sign of burnout that you may be aware of or that you should look out for is appearance changes, like whether somebody gained or lost some drastic weight, or declining in their grooming or their hygiene. And these are all burnout symptoms of adults and children alike. So we're here because we want to tell you that the mental health and well-being of teachers can have a really important impact on the mental health and well-being of children who they're spending most of their days with. I'm sure that you all know that already, but I also know that teachers need to feel safe and supported in their school environment for students to learn and be successful. So the reason I put this picture out is because it's the put your oxygen mask on before you put anybody else's on. We want you to know that it's okay to take care of you. In fact, it's recommended that you take care of you. As a mom of two, it's very hard to understand this picture sometimes, but again, as a mental health provider, you have to understand that if you're not okay and your cup is overfull, your children or your students or those around you are not going to be okay. So let's talk a little bit about the impact of burnout. We'll start at stage 2, the onset of stress. When COVID started, people were having a little bit of anxiety, maybe some inability to focus. They were looking more at social media, so they were seeing more about the coronavirus coming about. And then Corona hit us in March, and we were forced to change everything from your working habits to your eating habits to your sleeping habits to your family patterns, all of that. So that led to chronic stress because that lasted a good while. And especially for teachers, if you're not year round, it lasted for a couple months where you had to pivot from March to May to get those lesson plans done in a completely different platform. Stage 4, burnout. You may have had a little bit of a break during the summer. You may not have. Either way, you are still struggling with being, isolated and being obsessed with PPE or toilet paper or Clorox wipes, and then trying to plan a lesson plan on top of that. Stage 5, habitual burnout, can lead to chronic sadness, chronic mental fatigue, chronic physical fatigue. 18 months later, we can all say that we are burnt out by this situation. The problem, though, is that empathy fatigue and compassion fatigue, they are forms of vicarious trauma. You're not only having to deal with your stuff and the stuff of your students or the stuff of your kids, but you're having to deal with the stuff of your students as well. You're hearing and supporting the issues of concerns for them. These can lead to devastating symptoms like lack of compassion and empathy, and can also lead to a cynical attitude, which is definitely not what we want teachers or school personnel who are teaching our future to get to. So let's go to another word cloud. What do you do for self-care? So give me 1 second. And so you're going to text the same number. Well, you've already texted, so you can just go ahead and put in what you do for self-care. Yes, exercise. Good. Running, exercise. Yes, I love to run. Walking. Definitely. exercise, go exercise, baking, yes. Oh my gosh, can I be your friend? Manicures, definitely, absolutely. Music, blast music, gardening, take a break, watching Netflix, mani-pedi, nap. Absolutely, I think we should go back to taking naps like we did when we were in kindergarten. So all these are great, great, great strategies for self-care. And they keep coming. I love it. I'm so glad that you guys can identify so many different ways to participate in self-care for yourself. So I want to share a couple more with you that aren't often always as obvious as walking or running or baking or yoga or mani-pedis. So for the first one, know and respect your limitations. We always talk about boundaries in mental health, and it is so true now with the pandemic that we have to acknowledge and understand our own boundaries. We have to know when to say no, and we have to know when to say, I need a break or I need help. Also, on the flip end, know your triggers. Know what is making you more frustrated, more sad, more anxious, and stay away from that. It's okay to cut toxic people out of your life. I am giving you that permission right now. The personal restoration, all of those examples that you guys gave right now is self-care. You need to refill your tank before you can refill others, to make sure that your mind is healthy and well. Social support, have a network. You're not going through this alone. And you don't need to take it all on by yourself. There are other teachers, there are other assistant principals, there are other school personnel that have been in the same boat as you. Talk with them, ask them how they're doing. You'd be surprised how just a simple text can change somebody's day. Also, practice what you preach. You always teach your students to be compassionate with themselves and to speak to themselves with kindness and empathy. Well, do that to yourself. Make sure that you're not holding yourself to a different standard that you wouldn't hold your kiddos to. So, one other thing that you can put in your toolbox that I absolutely love, and I do it several times a day, is box breathing. Box breathing is where you breathe in for 4 seconds, or you can count as many seconds as you want, but we're going to practice it with 4 seconds. So you breathe in for 4, hold for 4, out for 4, hold for 4. So what I'm going to do is I am going to set my timer for 1 minute. And if anything else, you're at least going to get that today to practice some breathing. So let's go ahead and start. I have started the timer for 1 minute. Breathe in for 4. Hold. Out. Hold. In. Keep going. And we're done. So practice that. It takes a minute Just do it a minute here, a minute there. Do it while you're driving. Do it while you're in the restroom. Do it while you're making dinner. Do it while one of your students is yelling at the top of their lungs. Do it while your kids are asking help for your own kids are asking for help in their homework. Breathe. If breathing will help you de-stress, and it is a very, very quick way to get you to a different mindset. So, quiz time. I told you this was an engaging presentation. The top 3 individuals who win will get a Starbucks gift card, but please use your email as a sign-in. So on the next screen, when I send you to the Kahoot, when you sign in, put in just like that, darms at, and then if it fits, if the rest of your email fits, great. If not, as long as we have that first piece, we can identify you as registration. And if you are in the top 3, please send your full email in the chat so that our administrator can get me that, and you can get your free Starbucks gift card. Who doesn't want a free Starbucks gift card? So let's go ahead and share this Kahoot. And it is loading the game pin. So once you get to your game pin, two 6-8-5-7-6-1. Thank you. Okay, we'll wait 30 more seconds. All right. Let's go ahead and start. So school personnel. First one is the quiz. Percent of adults struggling with mental health and substance use disorders. Is it 10%, 2%, 100%, or 40%? And this is during the COVID period. Okay, we got 26 answers. We're going to go ahead and go to the, let's see. Yes, it is 40%. 10% was prior to COVID. And yeah, it seems like it could be 100%. So let's see who is, okay, John Ween, Lindsay, and Andre. Perfect. Let's go to the next one. True or false? 1 in 10 teachers indicate they would leave the profession. True or false? Okay. We're gonna go ahead and true. It was actually false. It was 25%. 1 in 4 teachers. I know 1 in 10 teachers already seems like a lot, but it's actually 1 in 4. So Lindsay rises in the scoreboard. All right. Let's see. Last question. What are strategies to boost resiliency? Knowing your boundaries, having a social support network, drinking a bottle of wine a night, or A and B. All right. A and B, yes. Well, I'm glad that nobody put drinking a bottle of wine a night, because studies have shown that substance use is also on the rise. 13% of adults in the US have said that they have increased their amount of substance uses. So yeah, so let's go ahead and see who is on the podium. So third is Armendez. Thank you, Armendez. Perfect. All right. Awesome. So thank you guys for playing. There will be another one at the end of the presentation. So please stay tuned for that one. All right, so let's do a poll real quick before we switch into talking about kids. We wanted to make sure that the first part you knew that most important was that you need to take care of yourself. But let's go ahead and switch on to talking about our kiddos. Cindy, can you put that poll up, please? Cindy? Well, we must have some technical difficulties. We'll go with all ages.
Sorry.
That's okay.
You want me to launch them now?
Yes, please. Thank you.
Okay.
So if you can let us know what ages you work with, 0 to 10, 11 to 14, 15 to 18. There are some different strategies depending on the age range that you work with. All right. What do we got? So sharing. Okay, so we have a couple people who don't work with any of the students, other 18 plus. It looks like a really good mix here. Okay. Let's do the next poll. The next poll would be asking for those of you that work with kiddos, what behaviors have you seen in your kids during, which ones have they exhibited during this pandemic? Okay, let's go ahead and see what people are saying. By the way, these are all signs of frustration, anxiety, depression, of, students not being well, verbally saying they have negative feelings, acting out, regressive behaviors, sucking their thumb when they're like older, like 8, somatic complaints. They can either, have a stomach ache, a headache, and a lot of you said all of the above. It's pretty 68%. And it's unfortunate because oftentimes they can't articulate or identify what it is that they're feeling. I remember my nephew lashing out one day early on during COVID, and later that evening he came to us and he was like, my mind isn't right. He didn't have the words to say he was feeling anxious or he was scared or he was fearful. He was lashing out. He was angry, and he was angry for, what we didn't, why we didn't understand. So this quote is actually from a high school student that participated in a focus group regarding COVID. And she said, we asked, what is it that you need? And she's like, understanding that, I'm not okay right now. A lot of our students are feeling that way. They're not okay at home. The isolation in itself has taken a toll of them. If you were in 3rd grade, that was the last year you had as, a regular school year. And then now you're in 6th grade, which it's completely different. You're in a different setting. You're in a different developmental stage. Excuse me. So of course, COVID was going to have an impact on children. We've seen mental health issues in CAD, which is children and adolescents, that have been on the rise for decades. Oftentimes, what we've seen in the pandemic is that 3 to 6-year-olds become a lot more clingy, and 16 to 18 years of age, they have more inattention or irritability. In a study, it was reported that a quarter of kids had increase in sleep due to worry, increase in sleep disturbances, and also that ER visits had increased 31% for mental health issues for 12 to 17-year-olds during the pandemic. And lastly, which is really, really scary, 25% of young adults from 10% pre-COVID seriously considered suicide. So being the National Hispanic and Latino Mental Health Technology Transfer, we want to make sure that we're talking about how this impacts Latino children differently. Technically or metaphorically, we were all in the same storm when it came to COVID, but some people weathered it in the comfort of their yachts, while others furiously paddled through the waves in their canoes. This is very true of how our Latino communities have gone through it. Latinos have higher levels of being under-resourced. being that they are, less likely to be insured. They may work low wage, frontline, hourly, essential jobs. They may have more exposure to conditions that limit social distancing. They may live in communities that have less access to healthy food. So they may live in food deserts or be food insecure. They may not have access to good preventative or even just medical care. Um, and on top of that, Latinos and Blacks were dying at even a more disproportionately high rate of COVID. All of this leads to educational debt. These longstanding and existing inequities in our education and our health systems have been compounded and amplified during this pandemic. And this has resulted in disparate access to not just education, but health, by having personal protective equipment, having the right technology, or even having the ability to work from home. So I'm not sure if you all remember this, but this was on the news. It came out, this was in Salinas, California, and the photo was first posted to Instagram with the caption, "The two young Latino girls were looking for a place with Wi-Fi to do their schoolwork, so they sat near Taco Bell to connect the free Wi-Fi." How incredibly challenging it must be for children to have to travel to an unknown space to be able to just complete their basic work for education. That picture really hits home on how it impacts Latinos differently. COVID also exacerbated a couple things in Latino children. So for acute deprivation of nutrition, oftentimes Latino children are part of a community in which there are food deserts, or their food comes they participate in free or reduced cost lunch and breakfast programs now. When school's taken away, those two meals, the strongest meals that they probably had in a day, were now removed. Now I know some school systems worked to curb that and opened up their doors and pivoted and worked really hard to still get these children fed, which is amazing. But it still doesn't negate the fact that happened. And when deprivation of nutrition happens, you have developmental issues, you have mental health issues, you have medical concerns. Another thing that was exasperated in the Latino children because of the disparities already in our community was protection. So a home represents a sense of security and safety. However, with the restriction of movements due to lockdown, maybe families were more isolated in the home. Parents could have been more frustrated, maybe losing jobs or losing hourly wages, that they could have been at risk for abuse and neglect, and additionally to exploitation. If they needed a kid to work, potentially there could have been a way where parents could have exploited, or family could have exploited the children by work labor or even sex labor. So COVID has definitely exacerbated these things in our communities. How teachers can help students: be present, practice active listening, and be purposeful with the quality time that you all have in your day. Practice breathing, just like we did the box breathing. Teach that to your students. You never know when that may help them. Practice kindness. A good way to get yourself out of a bad mental health space is to do something nice and kind for someone else. So maybe administrators work something so that your 5th grade classrooms are doing something for your 1st grade classrooms and vice versa. Be grateful. Have students practice gratitude by writing in a journal or using a journal to reflect by creating art or poems or being creative in a way. And then the most important one is destigmatize. If you start talking about mental health and you start saying that mental health matters, the conversations run a lot more easy, I can guarantee it. And additionally to that, people will come to you and recognize you as a safe space. So how school personnel can help families have a town hall by engaging parents at times that they can actually attend services, or make it virtual, or make it in a space that they can all go to, and make it safe. Make sure that you invite the marginalized communities to participate also in focus groups. Make sure that you have representation from all sides of the demographic line to also different socioeconomic statuses. And then offer services in different languages at different times. Like I said earlier, make sure that you're having meetings that allow working parents to come to, and that they can get the information in a way that is best for them, whether that be written, whether that be oral. And if it's written, make sure it's in a language, in their first language, in the language that they're most comfortable in. So for more tips, next week we will be talking about parent engagement and the resiliency in school. So come back next week to learn more tips to engage parents. But here, these are a few that you can work with. So in order to talk about like being prepared for the next time, we have to understand how we got here. So in 2009, 12 states, or actually, I'm sorry, in 2009 to 2012, a majority of states cut their mental health budgets, and this was cut by 4.3 billion with a B, billion. And in 2016, HHS predicted that there was going to be a demand for 250,000 mental health workers by 2025. And this was because the rates of depression were surging from 1 to 10 to 4 to 10, 1 to 10 to 4 to 10 in adults. There's some geographical areas that have one mental health professional per 30,000 individuals. Now, I know you all in the school systems get this probably more than anybody else does. You do not have enough bandwidth, enough capacity to deal with all the issues that all your students are bringing to it. That is why we're asking you to partner with your mental health providers. Get yourself trained and educated to understand the symptoms and the signs. So some of those things that you can do to prepare for hopefully not existing next time. Hopefully we won't have to go through another global pandemic ever. But be aware that safety isn't going to be realized until communities of color are equitably served. And we have to come to the realization that some communities do face additional barriers, like the Latino community, and those are the barriers that I just talked about a couple slides ago. We have to work together to foster that safety and that equity. Destigmatize mental health, not even just in the classroom, but in the school system, school personnel. Offer wellness classes for your teachers. Offer a space. Here at my business, we have a yoga room where we can go and just breathe and listen to soothing music and smell some really amazing fragrance, and just sit with a moment. Offer that to your teachers, offer that to your students. Start a mental health committee at your school. Include parents, students, teachers, other administrators. even at least do a campaign. You know, every May there's Children's Mental Health Day. Do a campaign in May to actually make it acknowledged that you are a space where we can, you know, that kids can come talk about mental health, and you're acknowledging the importance of it by doing a campaign. And keep communication open. And I say that for school personnel to teachers. Oftentimes what we hear a lot is that there was no communication. We were kind of left out in the wind. And I think parents sometimes feel that way too. It's okay that, I don't know why my thing just changed. Let's get to, oh, there we go. You know, people fear that they'll appear weak because they don't know, and inexperienced leaders often say, like, they'll make up the answer or pretend to know rather than acknowledge that they have no idea. But actually, studies have shown that it's okay to drop the superhero act and say, I don't know, but let's figure it out together. Schools do have a strong sense of community, so help foster that, and make sure that you're also trauma informed and that your policies and procedures support that as well. Okay, we're going to do our last Kahoot. Let's go to, all right. So again, make sure you put your email as the sign-in. We have 3 winners for the first game. The pin is 4353687. All right, let's go ahead and start this game. Okay, so the impact of COVID and Latino children. Quiz time. Impact on young children shows up like irritable, inattentive, clingy, or all of the above. Okay. 5 more seconds. All right. Yes, all of the above. Irritability and inattention, specifically in the older ages, and clinginess in the younger ages. So let's see the scoreboard. Denise Flores, S. Arteaga, and Veronica. Let's go next question. True or false? During COVID, a study of children and adolescents showed 10% considered suicide. True or false? Okay, 5 more seconds. The answer is false. It was actually 25% during COVID. It was a trick question. Sorry, y'all. But yeah, it used to be 10% pre-COVID, and now it's actually 25%. So 1 in 4 kids. So Denise stays on top, Dan and Kelly in third. Last question. Latinos are disproportionately impacted by COVID because it is not sharing. There we go. Underemployed, food insecurity, housing instability, most didn't get sick, strong familial bonds, or none of the above. 5 more seconds. All right. So yes, unfortunately, our community is disproportionately impacted because we have higher rates of underemployment, food insecure, and housing instability. Now, we do have strong familial bonds, and talking about a resiliency factor that we can use to help move forward is that familial bonds, and using those people around the child to make a bigger impact often can be really, really beneficial. So let's look at the podium. All right, Dan, if you can send us your email, that would be great, so you can get your specific Starbucks card. So let's finish up here. I know we have a couple minutes. Let's do one more word cloud about how you're feeling about this next year. And you can text the same 22333 Diane Arms 865. And better, good, I'm glad. Hopeful, yes, exactly what we want to hear. Uneasy and worried, that's okay. It is definitely okay to still feel these feelings, nervous, stressed, apprehensive, uneasy. And for those that are still, apprehensive or stressed or uneasy, please put in the chat how we can help, how the National Hispanic and Latino Mental Health Technology Transfer Center can support you. Would you like more wellness presentations? Would you like a space to meet other teachers from different parts of the country, maybe work through, see what they're doing and how they got through COVID, or how they're getting through COVID, because it's technically not over yet. Excited, but the resounding word is hopeful, and I'm glad to hear that. So one more thing. I wanted to put this tweet in by Ken Buck. Don't know who Ken Buck is. And I'm just going to read the first part of it. We gave educators almost no notice. We asked them to completely redesign what school looks like, and in about 24 hours, local administrators and teachers Apollo 13'd the problem and fixed it. Kids learned, children being fed, needs being met in the midst of a global crisis. No state agency did this. No so-called national experts on curriculum. The local educators fixed it in hours. So I want you all to remember that. And from us, we want to say a huge, huge, huge thank you. As a mother of two, like I said before, I am so incredibly grateful to the teachers and school administrators who have helped our kiddos transition in through this very, very difficult time. Please don't forget to take care of yourself, because you can't be okay for somebody if you're not okay for yourself. So if you want to connect with me on LinkedIn, this is my QR code, or you can find me by Diane Arms. Also, we do have our next presentation, October 8th, Strategies for Parents, where we will be specifically talking about strategies, how to help parents get through these difficult times and support their children, but also for school personnel and how to engage parents. I will throw it back to you, Cindy or Cynthia. I mean, Christina, I'm sorry.
Thank you so much, Diane, for sharing for your excellent presentations and sharing needed strategies for teachers and school administrators serving Hispanic and Latino children and youth. I don't know if everybody is here to see if we have questions.
Yes, I'm here. Remember, everybody, that if you have questions for Diane, you can submit it via our question pod in your dashboard in the control panel or in the chat. If you want, we'll give it a couple of minutes to see if we have some questions for Diane.
The presentation is also in the handouts section.
It appears we don't have any questions as of now. So, Christine, if you want to close or you have anything more to add.
Yes, perfect. Thank you, Diane, for your excellent presentation. It was wonderful. And thank you all of you for being here. We hope you have a great day. Thank you so much, and see you in the next one.
Thank you, everybody.